Thank you.
Good afternoon. My name is Amy Hatton. I'm the health analyst for the Council of Community Clinics, 4646 Mission Gorge Place. I'm here on behalf of our board of directors who have voted to support the plan as presented to you today. This document represents many hours of hard work by many of the leaders in the community. The plan is not perfect and represents a compromise, yet it does reflect a San Diego plan. We encourage you to adopt the plan as presented. Thank you for your consideration.
Thank you very much. Next speaker.
My name is Richard Halverson. I'm with the United Taxpayers of San Diego. We're also here to support the plan as a conciliatory effort, and we want to see it proceed. Wish to thank Dr. Ross and Paul Sims in particular for allowing me to have my input at their meetings, and with the Health Care for Reform Commission. We know there's been a lot of hard work that's gone into it. If we were to go back to the first day, though, there was some different procedure that we would have recommended. One was the people who participated in the commission would have requested, for example, that each supervisor appoint people to the commission, representative of their districts, and that more of the interested parties, particularly the beneficiaries. We've heard a lot about the consumers and the players, but beneficiaries, those actually receiving the benefits, I think we could have had some helpful input from them. Also, I know that certain of the parties that were represented did go back to their groups and ask for opinion. And so what they represented was a consensus or a compromise on part of their particular groups. But I think that some of the other people who served on the commission were primarily representing their own interests and not necessarily the interests of their groups. I have associates that are on the Chamber of Commerce, and they were only incidentally notified. I don't think a vote was taken. So in that particular case, it may perhaps be only the one individual who was representative of that body, also with some of the other organizations. As far as taxpayers were concerned, I called the San Diego group. Ms. Freitas works for Dr. Arce. I also called the legal aid, and they said, we've got it taken care of, come to our meeting. But at the legal aid, primarily the die was already cast, and we were not really players. Most of the people who were at that meeting favored a single payer plan, not the compromise that's on the board. So I would recommend that you continue with the operation and particularly approve the portion that has to do with the PCCMs and receive the report and continue to observe as it's actually implemented. So it would be sort of, as Dr. Ross, I think, implied in his particular speech, that it would be subject to final drafting of legislation and not particularly full and concise acceptance of the report. Thank you.
Thank you, sir. Next speaker.
Good afternoon. My name is Richard Levy. I'm a chairman of a task force. I have spoken to you before, of the San Diego County Pharmacists Association and the San Diego Society of Hospital Pharmacists. I come here to you representing both of those groups and the 1,500 licensed pharmacists practicing here now in San Diego County. We have followed the process of development of a system for Medi-Cal managed care within San Diego. We supported the original plan, and we also support this Healthy San Diego plan. We feel that the best provision of pharmaceutical care can be provided by a locally managed program of San Diego providers. We will continue to work toward patient access, cost-effective services, and optimal drug therapy in this population. And we would stress that practicing San Diego pharmacists be involved in the design, implementation, and oversight of this project. Thank you.
Thank you. Next speaker.
Hello, I'm Dr. Carlos Sanchez. I'm a pediatrician. I'm a president of the California Hispanic Medical Association and chairman of the Coalition of Medical Providers and Consumers. I voted in favor, but tell you the truth, I'm not too happy with it. But Dr. Ross is a good leader and kind of got us together. But I'd like to explain a few things. I've been working for 23 years with Medi-Cal 5 miles north of the border of Tijuana. In other words, down in Chula Vista. And for all those years of 23, Medi-Cal, as far as I know, has all the time been a managed care. As a matter of fact, it's been so well managed that they're I don't want to bring fees in here, but they're the most predatory of all of them. They all, if you start to understand, when Sacramento formed this thing, it had to be a managed care. They just didn't throw money on the bench and say, pick up whatever you want. Many doctors know this was well managed. I mean, you just can't admit a patient anytime you want. You can't do anything you want. You have to get permission. So now the fee for code, or the fee for service, is a misnomer. It's not fee for service. It's a fee for code. It's a capitated fee. In other words, you just can't go and charge a fee and you're going to get paid that. It's all even. And as a matter of fact, just to give you an example, most of the visits they pay is about $7 to $10. A haircut costs about $10. If you take your dog to the vet, it'll cost you about $100. So what I'm trying to urge you is somehow Medi-Cal as it is, it needs to be reorganized. You don't need to dismantle it. This is a big infrastructure. Our tax dollars have gone into it to actually provide a good managed care. What it needs to be regulated. The reasons for outside expenses is the expansion of Medi-Cal recipients. And I really will urge you to look into this and probably keep the infrastructure we have. What you're going to do now by forming this managed care, it's just a name. What they want to do is give this entity and divide it into different multiple systems. Basically what President Clinton wants to do is a single payer system. That's what we have right now, a single payer system from Sacramento. This is going to disturb the patient relationship. They're going to disturb all kinds of entities that we have already in work. I think all it needs to be done is regulate, such as multiple visits and so on. But even at that, as if they call it abuse, it's cheaper program. If you go into the managed care system, the people who are going to manage these things, they are going there to manage because the money to be made is in managing the system. You don't think they're going to do it for the goodness of the patients. And believe me, this is what's going to happen. So the other thing on this is
Sir,
that
excuse me, could you please finish up?
Yeah, okay. Although I've been for a whole year in this, I'm still a little confused, and especially consumers. And thank you very much.
Thank you. Next speaker.
So my name is Diana Lozano, and I came because I am a citizen of the United States, and I'm presently on Medi-Cal. And I just wanted to state that by law, I have the right to be treated equally, free of all prejudice, no matter what my age is, no matter what my ethnic group is, no matter what my income bracket is. I feel we should have the right to choose what doctors we want to see. We shouldn't be put into a big medical building and you come in, you're sick, and any doctor comes to see you. We should have that doctor-patient relationship. I don't want to have to go in every time and, this doctor's examining me today, this other doctor will examine me tomorrow. I feel that we should have the right to choose our doctors, not just like all of you. I'm sure you choose your doctors too. And I don't think you would like it if your rights were taken away from you. I know you're trying to fix the budget, minimize the amount of money that's spending. But I don't understand that, actually, the budget, what you're talking about. Because, we have all this money to give to other nations to help. They're hungry, they're ill. We have money to give to them. What happened to the people of the United States? I'm a taxpayer too. My mother's a taxpayer. I'm not low income because I choose to be. I'm a college student. I'm trying to better myself. But I still, as a citizen, I have a right to choose who I want to be treated by. And Medi-Cal has cut already medications. It's like we have to pay for a lot of our medications now, or we get generic medications. That isn't right neither. And it's like dental work now. The only thing you can get done now is you get your cavities filled or you get your tooth pulled.
Madam
And that
Chair,
isn't right. Just because we're low income
I don't
doesn't.
want to shut anybody up, but I just like to, the motion is on the floor, workers to the motion, and we can't change Medi-Cal. That's the
Right.
state, and they're the
No, what I'm just
sovereigns,
trying
and
to
they've
state,
decided
what I'm trying to
how
state
that's
is
going
it's
to
been
be. So-
changed already so much that it shouldn't be taken away from us, and you shouldn't change it anymore. That's what I'm trying to say. I'm not trying to say go back and redo what you've already done. I'm just trying to say help the situation, the system that we already have now, instead of taking it away from us and trying to give us a new one. That's what I'm asking.
Okay, thank you. Just to let all of you know, actually, several of us on the board are members of HMOs, and we do not choose our own doctors, and in fact, we get generic medications as well because it's more cost effective. Next speaker.
Thank you.
I just want to say that I think that a relationship with the one physician.
Can you identify yourself?
Yes, my name is Christina Lozano, and I'm also a taxpayer. I notice that a lot of them have very high positions here, and they're talking, and they're saying, oh, well, we agree, or well, this is great. That's fine. Maybe they have the money and ability to choose their own doctors all the time. I'm not on Medi-Cal. I'm in between the system where they say you're not either rich or you're not either poor, and I can't even go to the dentist because I can't afford it. Okay, I don't have Medi-Cal. I haven't had it for years, but I'm talking about the children that we take care of as foster care, and that the children, you're taking away their self-esteem, you're taking away their dignity, because they're going to have to be seeing different doctors all the time. As they're growing up, they have to neck at themselves in different doctors all the time. That's what these big medicals are. They are different doctors. You never get the same doctor. You never get the same relationship. You never get that bonding between doctor and patient relationship. And I think that it's wrong. You've taken enough out of Medi-Cal already to hurt us poor. We're not. It's not our fault that we're poor. And I think that you haven't given us the right to come over here and fight and say, hey, listen to us. You haven't mailed us any mail. You don't do any of those things. You make the decisions for us as poor people, and we have to accept it. We know about it when you've already built these big buildings and have these doctors and you don't give us the opportunity to come over here and talk to you and tell you, hey, we have a right as citizens. Also, you just shove us to the side because we're poor, and you make the decisions for our lives. But you're making the decisions for our life as medical. It's our health. Okay, you're taking away a lot of things. That's right. We're not asking for privileges. We're asking that we have as human beings, not as animals, and we have intelligence to also decide what we want. If we want to just go with a group where you shove us and make this big building because you want to save a buck, because you want to save money. Okay, but what about our health? You're not even giving us that opportunity for us to say that that's what we want. And you never mail us, never to the poor people, and let us know that these meetings are going on. You never let us know until you've done the decisions for us, because you always make the decisions for us, and we know it when it's too late already. Thank you.
Thank you. Next speaker.
Good afternoon. My name is Edith Hamrick, and all I have to say is my husband and me, we are taxpayers also, and I am here to represent the foster mothers. I am very happy. I have been very happy with the system of Medi-Cal, because that gives us the opportunity to choose our own doctors. And I would like to have your consideration and try to delay this new program that you are trying to put in. Thank you very much.
Thank you. Next speaker.
Good afternoon. My name is Virginia Kelly. I've been a foster parent for 23 years. Imagine how many children been through my home. Any of my children has Medi-Cal. I'm very satisfied with the system. Please help us to continually doing the benefit for the children. They're going to be the future of tomorrow. Thank you very much.
Thank you. Are there more speakers?
Madam Chairwoman, that concludes public testimony.
Okay. I'd like to just state one more thing, since I have been an HMO member for 5 years now, almost 6 years. And I have a daughter who has been seen by a doctor through the HMO for the last 6 years. And she's seen the same doctor. The doctor was assigned to us. We liked him very much. If we'd not liked him, we could have requested another one. But we've seen him for the last 6 years, and it's been a satisfactory arrangement. I think it's a new plan, and it's frightening to some people because it's new. But I think that I found it extremely satisfactory, and I don't choose my own doctor personally, but it is a cost-effective way of providing quality care. So I think that several statements that were made today having to do with everyone having the right to choose everything, I'm afraid with the escalation in cost of 20% per year in this program alone, it now costs the county $720 million to provide this. That's a tremendous amount of money, and if it escalates to 20% per year, we're going to come to the point where we have no more money and people will be cut off altogether. So we are being forced as the state and the federal government to find more cost-effective ways that still preserve care. It should by no means be taken that people who are on managed care programs, HMOs, will not have care for their children, because that's simply not true. I just wanted to clarify that. Dr. Ross, would you like to speak now to some of the concerns that you had?
Just very briefly, thank you, Madam Chair. I understand that as public officials, you can say anything about us you want and get away with it. That's the business we're in. But I do have concerns because this is such a critical issue for the county and for your board. When allegations of a cover-up and withholding information from this board willfully are thrown about, they have to be dealt with because I have to take a charge like that extremely seriously. And I'll make my remarks regarding Mr. Coppa and his allegations. The concept of a trust, which I think the concept of a publicly held trust has some merit. I'm not saying it's a bad idea or a dumb idea. What it doesn't have at this point in time is a lot of community support, and also it may be a little bit premature with all the uncertainty going on in Washington and Sacramento right now for the county to make that big a leap into what would be a new bureaucracy, big bureaucracy, much bigger than this bureaucracy. Secondly, I did meet with Mr. Coppa and his partner, Mr. Carl, in my office on October 12th, 1993 for an hour. They did have the opportunity to present their concerns to your board aides on September 3rd, 1993. They've attended every Healthcare Commission meeting and have had the opportunity to speak. They've attended all the ad hoc committee meetings and have had an opportunity to speak. If this is a cover-up, we've done an awful job of withholding information. So with that, I just needed to address some of those issues because I do take those allegations extremely seriously. Thank you.
And could you please just clarify, since I brought this point up, but I'd like to have you, since you and Supervisor Williams worked on this, is there any danger that Medi-Cal covered children who are foster care children will be dropped from the rolls or not receive medical care as a result of this proposal?
If I could have
Dr.
Deputy
Sims?
Director Sims address that.
Madam Chairwoman, members of the board, when the issues of foster mothers and Medi-Cal first came to our attention, they came up as a result of showing up in the infant mortality files. Some 25% of all infants who died in San Diego County between 89 and 91 were in the care and custody of foster mothers. So I and my staff spent some time with them to understand what their issues were. As it turns out, many of the infants are medically fragile, so it's not unreasonable for them to have been overrepresented in the group of parents who had infants in their care and custody who died. In the course of those discussions, however, it came out that a significant number of pediatricians were not familiar with cocaine and its impact on infants who were exposed in utero. A number of them had difficulties in traveling to physicians, and as foster kids move around from house to house, that may create a problem if you have a local managed care entity that doesn't serve North County and South Bay simultaneously. Earlier this week, I myself met with Dolores Stroh, who is the immediate past president of the Foster Parents Association. She has agreed to schedule a meeting with my staff to better understand the operational issues so that we can make sure that in the design of the RFP system, the issues around foster children are specifically addressed. They welcomed the extension of our offices specifically, and I can assure you that which we have heard today, thus far, in terms of operational problems, are in no way insurmountable, but can, I believe, effectively addressed in a managed care system. Thank you.
Thank you. I have now Supervisor McDonald and Supervisor Williams, and then
may I have a rebuttal
Supervisor
to the comments
No, not
made?
at this time. It's out of order, sir. It's time for board discussion. If a board member wishes to ask you a question, that would be the appropriate time, but it's not appropriate now.
My name was brought up in a derogatory manner.
I'm sorry, sir, not at this time. Supervisor McDonald, if one of the board members wishes to ask you a question. Supervisor McDonald?
Madam Chair, first of all, after studying this and after having been briefed on the whole concept, and I understand it much better than I did before the briefing now, I want to commend Dr. Ross and Supervisor Williams and all those who participated in this process, because I think that although this is probably not going to be pleasing to some, I believe that without moving in this direction, we will be endangering many, many people from any kind of medical care. I have lived through a period when managed care did not exist, and I've lived through a period where cost of health has escalated exponentially to the point where the general public is not going to continue to be able to afford health care unless we come up with some kind of a proposal like this. I also have been, as a member of an HMO for 3 or 4 years, I've changed my doctors 3 times, and I had a doctor that was my doctor for 30 years. He retired. I had to change to another doctor, had to change to another doctor when I changed insurance programs, and I have not been unhappy with the kind of medical care that I have received. So I just, again, want to speak in favor of the motion and again commend Mr. Williams for his leadership and Dr. Ross and all of those who worked on this program.
Thank you. Supervisor Williams, are you ready?
Yes, Madam Chair. I just want to add to the comments that some of them that you've already made. There was an objection to the suggestion that the board members should have appointed the commission members. The board members did appoint. It was the Health Department's recommendation, Dr. Cox, who was the director then. So the board, all of us together, appointed the Health Care Commission and provided the staff support for it and all that sort of thing. So that was not done behind any closed doors or there was nothing unobjective about that, and we took care to have all kinds of interest groups involved in it, including the consumers that were referred to, and they were not unvocal, as you heard today from some of the members who were here. And I want to say I'm a member of an HMO and have been a member of an HMO since almost all of my adult life right here in San Diego, and I can, as you mentioned, select from a certain panel of physicians, the ones on the staff. But that has a substantial advantage to me and to my family because no matter what time of the day or night or the week or the year, there's somebody there always. If there's something happens to you, you can get them. It doesn't matter if your doctor's on vacation or whatever, there's somebody there to take care of your medical needs. And I find that to be a substantial advantage, and I find them all to be competent, and they are courteous and considerate, and I have had nothing but very satisfactory service from that HMO. There's and I also belong to a dental plan that the county provides, for which I pay. I guess most of us do, and the dentist that I have been using all my life, the only dentist that had ever seen me until I became a member of this board, I had to change to another dentist because he was not on the plan, and so you see, I mean, it's not a unique to what we're talking about here now. But I've gotten good service from the dentist. I've been very satisfied with his new dentist. He has been absolutely as good as the other dentist I had and has done his good work. So I don't see that as a problem. I do want to urge the board, though, to adopt the motion. There's still some work to do, as you know, and we believe that we can work it out with the state and with the other local interests. And some people have testified that they have a right, and I would wish that would be the case. We have a right to medical care, no matter how much it costs, and that may be okay in the ideal, but we know that the cost of medical care has gone into the sky. We're not going to be able to continue to afford it as it has been provided in the past, and somebody's got to pay for it. If the person who doesn't have the money, who's getting the service doesn't have the money to pay, somebody's paying in the present system. But those somebody's, as you've pointed out, Madam Chair, are going to run out of the ability to keep on paying if this model that we're in right now continues to be the mode of operation. So it's absolutely necessary that some changes be made. We believe that the proposal we have now under the present law, what we know now, is the best that we can do. And we've given as much consideration to all the various points of view as we believe we could and make the thing workable. So I ask your support on the motion.
Thank you. Supervisor Jacob?
Thank you, Madam Chair. First, I'd like to thank the individuals that have been involved in this process, Mr. Williams and the Healthcare Committee, as well as Dr. Ross and Paul Sims, Randy Meacham in Health Services, Jim Lott from the Hospital Council that spoke earlier, Stephen Schubert, Council of Community Clinics, and there are many, many more individuals that have been working very